Hello, my name is Kira Morris, and I'm going to be talking to you guys a little bit about the full liquid diet today. I'm a part of the Wednesday group under Adams, and here is a list of the other people in my group. I would really appreciate it if you took a quick look, just because they all worked super duper hard on this, and I'm really proud, so I'm excited to be the one that's going to get to talk to you guys about this and present our presentation to y'all. So we're just going to start out and just get to it. What is a full liquid diet? A full liquid diet is a diet comprised of liquids or food that started in a liquid form or are at a liquid form at room temperature. An example, or liquid form at room temperature or body temperature. And an example of the latter would be like something like ice cream or jello. It is important to note that you're not supposed to eat any solid food if you're on a full liquid diet. And an easy way to think about this for me is that you really shouldn't have to be chewing a whole lot if you are on a full liquid diet. Maybe with the jello, but that's it. And it really shouldn't be hard to chew. There shouldn't be anything crunchy, etc. So let's unpack who would need to be on a full liquid diet and why would they need to be on a full liquid diet. Because if your patient's on this, they might be asking you questions. They might be a little freaked out at first because it sounds scary, but you can let them know that there's lots of delicious things that you can eat still on a full liquid diet. So a full liquid diet is used when a patient may not be able to tolerate or has to abstain from solid foods due to things like preparation for a medical test or procedure or before certain surgeries, temporarily post-op for a stomach or intestinal surgery, or a stepping stone between a clear liquid diet and a soft diet, or if they're experiencing things like dysphagia or trouble chewing. Also, this is what I think of when I hear full liquid diet: digestive diseases or digestive symptoms like inflammation, vomiting, and diarrhea. These clients will need something that really isn't hard on their gut at all and very easy to digest. We can take a look over here at this cute picture that we included. It shows you the whole digestive system. And if you're anything like me, before nursing school, when I heard digestive system, I really just thought of this area: the stomach, the pancreas, the intestines, stuff like that. But you can see that our digestive system starts in our mouth, and there are a lot of little other organ systems that play a role in our digestive system. So the aim of a full liquid diet is to promote the healing of your digestive tract, which includes everything from your mouth and throat to your colon and your rectum. So from top to bottom, we are trying to promote healing. So if there is an issue with any of these symptoms, you would probably start to be considered for something like a full liquid diet or a clear liquid diet. Let's watch this video. She does a really, really great job of explaining the full liquid diet and honestly some things that you wouldn't probably think would be in the full liquid diet that actually are. So let's go ahead and give it a watch. All right, so I really liked how she spoke about how many calories you can get. Approximately, she said approximately 12,000. So we know already that this diet is not going to be a diet that someone is going to be on forever, hopefully. Specifically, in the way that we're talking about it, obviously, someone could be on tube feeding for extended, very long periods of time, but the ingredients in tube feeding are very much different than the ingredients that we're talking about today, or the foods that we're talking about today. So we can just look up right at this picture. Here's some more examples. Fruit and veggie juice is okay, milk's okay, coffee and tea is okay, sports drinks, broth or soup without chunks. You're going to notice that a lot in our presentation. There's a big emphasis on no little noodles in your soup, no chunks of veggies, nothing like that, just the broth. And then sorbet or frozen yogurt. So there's still some fun little sweet treats you can eat while you're still on a full liquid diet. So you can have milk products like milkshakes, ice cream without chunks, frozen yogurt, and pudding. Vegetables and fruits, but they have to be in juice form. So, for example, tomato juice, apple juice. Grains and are cooked in refined cereals. So, again, this is where we hit a teeny bit of a gray area because yes, they can still have cream of wheat, but it's probably going to be thinned and not your typical cream of wheat. Same with oatmeal and grits. Most of the time, these cereals will have to be add a little bit more liquid than what's normal, just so that they can be extra easy to swallow without having to chew. Soups, so broth or strained soups. Gelatin, that would be like jello or pudding. And of course, Ensure, if you've been going to a clinical so far, then you've probably been in their nutrition room in the hospital. And it seems like almost every nutrition room in every hospital I've been to so far has Ensure in it. And especially pediatrics, I know they love their Ensure over there. Let's talk about some foods to avoid. Any raw, cooked, or canned fruits or vegetables. So this would be fruits and vegetables that are, still crunchy, but also even the canned forms are not okay just because they can have whole fruit and veggies in there. So even though they're soft, still we're not going to be eating them on a full liquid diet. Mashed fruits and vegetables such as mashed avocado, nuts and seeds, hard and soft cheeses, soups with noodles or other chunks, and bread. So yeah, obviously a couple of these things we can definitely just use our brains to roll out. We know nuts, seeds, bread, stuff like that, they are not going to be liquid at room temperature. Also, carbonated beverages such as sparkling water and soda, because those can be really irritating on the gut and the stomach. So now we have a little sample menu. So you can see that we get cream of wheat, but they specify it's thinned with 1% milk. We can have a protein shake, but we see that it's also thinned, and also if you notice on some of these menus that they have a little section at the bottom where it says you can add protein powder, flavored or unflavored, really depending on what your patient wants to each of these things. So we already are using our nursing brains to realize that if a client is on the full liquid diet, they're going to need some nutritional help with getting their protein up and also getting their fiber up. So let's talk about some side effects of a full liquid diet. Frequent loose stools due to not consuming any solids. Nausea, vomiting, and headaches These are usually more common in the first 48 hours after starting the diet. Fatigue, weight loss, and also constipation because of that lack of fiber. You're not getting those whole fruits and veggies anymore, or those whole grains or legumes, so you are not getting those really great sources of fiber. And like we talked about, on a full liquid diet, you can usually only get up to about 12,000 calories, and we know for an average adult person, they need about 2,000. So weight loss is going to be extremely common on this diet, and it's why this diet is not really seen as being a super long-term diet. It's more of a transitional diet. When do you need to call your healthcare provider? Call your healthcare provider right away if you have any of the following symptoms: a fever of 104 or higher, or if your healthcare provider gives you another parameter that's more specific to you; diarrhea that lasts more than a day; vomiting that does not stop; trouble urinating; and abdominal pain with bloating and cramping, or difficulty passing gas. So if we look at these last three symptoms, obviously if you're having trouble urinating on a full liquid diet, there's something wrong because you're basically consuming all liquids. So you should still be urinating. Abdominal pain with bloating and cramping, when I see that, I'm thinking there's probably some sort of lactose intolerance or aversion, because as you saw on that menu, there was a lot of dairy on there. So if you have a lactose intolerance and you're consuming all that dairy, there's going to be some discomfort in your abdominal area. And then difficulty passing gas. This is always just a sign in healthcare that we don't like to see, because that means that your digestive system is probably not really activated and not really working. And I feel like I would associate this with like an assessment. If you cannot hear someone's bowel sounds when they're on a full liquid diet, then we have some issues and we need to remedy them. How long will I be on this diet? A full liquid diet is temporary due to most of the time you may not get enough fiber, calories, or vitamins on this diet. So yeah, like we talked about earlier. If you are on it for 3 days or longer, additional nutrition requirements may be needed. So yeah, you're not going to get all your calories, so you're going to need to start supplementing with whatever is okay under this diet. And if instructed to be on it longer than 5 days, you need to contact your provider for the possibility of more nutrition that would be needed. And it's recommended to keep a log on what you eat each day to ensure you are getting the dietary needs that for your body type and age. And some modifications for a full liquid diet include: a patient on a full liquid diet, they need to have it tailored to them based on their general health, age, and medical conditions. Some examples are post-gastric surgery. These patients need to avoid acidic drinks like orange juice or coffee because this can irritate your stomach. Patients who have hypertension, they need this usually to limit their sodium and salt intake. So this is a great diet for them because you can modify whatever you're giving them to be low salt, low in anything that could raise their blood pressure. And a patient that is diabetic, they may need to monitor their glucose and their intake of carbohydrates. And it's just really important, I think, as a nurse to be thinking a little bit extra about these three patients, just because they're going to be a bit more sensitive, especially the diabetic patient, and they might have changes in their blood glucose or their blood pressure, and they'll need to be remedied immediately. Here are our references. I'll give you a second to look at that. And that's it. That's all for y'all. And thank you guys so much for watching. I'm Kira Morris, and I'm part of Adam's Wednesday group. Thank you.